So hair loss is the most emotionally charged up concern in dermatology OPD. Today we are going beyond the minoxidils and finasteride into the science of hair, psychology, regenerative medicine. These are the frontiers of hair restoration, and who better than Dr. B.S. Chandrashekhar, India's hairman, the most respected dermatologist, trichologist and educator, is decoding it for us. So welcome Dr. Chandrashekhar.
Thank you, Atul. Happy to be here with you.
So sir, we start with, how did your journey in trichology begin?
It's a fascinating story, Atul. Probably I started my practice in 1997. I was a fresh postgraduate from Mysore Medical College. Had worked as a lecturer in JSS for a year. For obvious reasons, I came to Bangalore. When I started, practice was very, very lean. The trichology patients were the first patients who walked into my clinic, surprisingly, yes. So when I started that, I had an idea, absolutely when minoxidil was there, the only one brand, I used to prescribe minoxidil, then patient used to take minoxidil, come back maybe after about 15-20 days, telogen loss, minoxidil induced, confidence due to shattered there. So nobody was there to guide us at that time. Few of my patients, they went to Tirupati, they bald their scalp.
Okay.
Then they started using minoxidil.
Fabulous.
After 3-4 months when they came in, it was phenomenally good result, which I could not believe. The problem is that the telogen loss of minoxidil is avoided. There's a huge surface area of the scalp to absorb minoxidil without hair. Results are obvious. That created a specific interest in trichology. I think that should be the starting point for me to believe trichology, believe hair science and believe minoxidil. That opened the entire Pandora box for me for trichology.
So Tirupati, the blessings of Tirupati.
Blessing of Lord Venkateshwara.
So why do you think, when we all started practice, late 90s was the time, over a period of 2-3 decades, why suddenly the hair loss has become so prevalent and it has shifted from one generation to another a decade earlier? You know, if father lost it in 40s, the sons are losing it maybe in mid 20s.
Probably one why we see a lot number of patients nowadays is the awareness. Thanks to our alternative medicine people. Because of their huge advertisements and huge market hype, the awareness is too much in patients. And thanks to the beauty pageant of India, smart guys, beautiful females, adorning their hair, getting into the hair market for advertisement, for oil and all. And more than that, this is on one side, but more than that, probably the lifestyle and the way our younger generation is getting exposed to androgen drive, the lifestyle, like food habits, the stress levels, very, very bad. You see, hair is a very, very metabolically active tissue in the body next to bone marrow.
Okay.
Anything which happens in your mind gets into the follicle. The stress gets into the follicle, causes premature telogen, then falls. So lifestyle factors, awareness, then the people want to look beautiful, and genetic influence. All these factors are flooded into the arena of hair. Thereby we get lot number of patients. But the psychology of children whose father is bald or mother side is bald or grandfather, that psychology is tremendous on them. So they just run to you even if they see about 4-5 hairs, which we normally think which is normal. So that is the awareness. And of course, because of all these reasons, naturally the hair loss patients are more now.
So we are divided into a few segments. So initially we start with androgenic alopecia, or we call it male pattern baldness or female pattern baldness. So we'll just unplug this and move on. Can you tell me, for common people who are not maybe young dermatologists or maybe common people who just doesn't know anything about medicine or human body, what is the pathophysiology of androgenic alopecia? How do one, what happens in body because of which person loses their hair?
Okay. Basically, what the pathophysiology, to understand the androgenetic alopecia, the first and foremost thing you look into genetics.
Right.
Where if father is bald, or father's father, or father's brothers, or mother's brothers, most of the baldness gene comes from mothers actually. People do not know about it. 95% of the confidence limit comes from mother side. If mother's father is bald or their mamas are bald, obviously they get a genetic thing.
Right.
That is number one. So genetically they are prone. They are programmed, like what we do programs in computer. It's a programmed premature death of a hair cell.
Right.
The second one, the DHT, that's the dihydrotestosterone. Normally, human vigor is with testosterone. That is the vigor. Whether it's a male or a female, both of us have got testosterone, for obviously because of our sexual function. By chance, if there is some defect in the receptor of the hair follicle, or the receptiveness of the follicle for the hormones is very high, this testosterone hormone gets converted to DHT, dihydrotestosterone. Here the receptor acceptance is large, like they just attract the hormone, get converted to DHT, which miniaturize the follicle. What is miniaturization? A terminal follicle over a period of time under the influence of DHT. Take an example, if it is 20 centimeter and about 3 millimeter thick, probably when the tide falls next dose it becomes 15, 2 millimeter thick. It falls again, it becomes 5 centimeter, 1 millimeter thick. Again it falls 2 centimeter, 0.2 millimeter. So slowly, progressively, once for all they don't lose hair. Like alopecia areata, where you see the hair loss immediately, but here progressive miniaturization, that is thinning of the hair over a period of time, causes baldness.
Right.
So that is basically DHT. Then the environmental factors. As I told you, the androgen stimulus for younger population is very huge now because of our lifestyle, and obviously there are so many reasons. Then we indulge in a lot of high calorie diet. The culture of gymming, culture of taking whey proteins, they all push DHT to a higher level. The stress level, the sleep is disturbed. So all these are act to the factors. If you want to divide pathophysiology of AGA, you will have to divide genetic factors, patient factor, environmental factor, hormone factor, especially in females. If they have a PCOD, PCOS, hyperandrogenic status, obviously they start losing hair. And added to that, metabolic syndrome, diabetes, smoking, alcohol, everything. As I told you, in anything you think about hair follicle, you always think that it's a very, very dynamic process in the follicle.
Right.
You know, the follicle is the first brain to develop. You may wonder.
Yeah.
If you get into the evolution of the whole life on the earth, the tentacles of Hydra, the process of Hydra, they are all the brains.
Right.
So that is the first brain to develop. Then the human brain has come. So anything happens here, because both of them the same origin, goes into the follicle.
Right. Fabulous. Made it very simple for all of us. So what do you think? What is the most dominating trigger? Genetics or hormonal?
Genetics is the dominant, both female and male pattern is mostly genetic. Female, there are multiple factors. But if you want to trigger, I think I would call genetics as a gun. It's a loaded gun.
Right.
Then you have hormone as a trigger.
Okay.
Then your environment, other factors comes as a pusher.
Okay. Nice analogy.
Enhancers.
Very nice analogy.
So it's gun.
Yeah. Very nice.
Loading, triggering and pushing.
So the difference between male and female pattern hair loss, what often young dermatologists tend to miss in terms of distribution or in terms of?
This is an important aspect. because every hair loss is not same.
Yeah.
For a common person, if they lose hair, they don't know whether it's a telogen loss or an androgenetic alopecia or something like a diffuse alopecia, senescent alopecia, we don't know. For a young dermatologist, the first thing probably what you should have is a clinical acumen to see the pattern. In male, it's a frontotemporal, which is going exactly like this. Then it becomes thin, which you can see on my scalp. In a female, this is preserved. The central thinning will happen. This is a major difference.
All right.
And of course, trichoscopy is the stethoscope of dermatologists.
Dermatologist, yeah.
If you don't have a trichoscope
I think.
or a dermoscope, I don't think trichology practice can never be possible.
Yeah.
We have gone to such a level with trichoscope. Obviously, you need to use trichoscope for it. Okay.
All right.
So with trichoscopy, you can feel the earliest features of androgenetic alopecia. If there is a 20% variation in the thickness of the hair, if there are some follicles which are empty, which have got a brown color around the follicle, all these will point towards the alopecia, which is of a male pattern or a female pattern.
Right.
And in female, it's a central thinning that has to be taken into consideration. Most of the time, we don't examine the vertex. I see a lot of my young doctors who come, who practice with us, they straight away put their head so that they don't see the occiput at all. They should see the occiput. That is one of the area where the earliest baldness can be picked up. And of course, the hair pull test, where you need to pull and see the integrity of the hair, how much hair is coming out. If it is more than 10 follicles per pull, like I normally do like this and see, I'll show them if there are more than 10 follicles, there's obviously the shedding phase is there. It can be a shedding phase of androgenetic alopecia or a patterned hair loss.
Yeah. So, you often come across patients where you will see this androgenic alopecia. Clinically, it's very mild, but emotionally, very distressed.
True.
How do you counsel this?
That's a very, very, I think, important aspect of our trichology practice. Especially this happens in teenage boys, maybe if they are around 15 to 18, and the girls between 11 to 15. This happens because they see the importance of hair in social life. And when they suddenly come, see, they don't know what is normal hair loss. Normally, when we talk about hair loss, we talk about 60 to 100 strands per day. That is the normal dialogue, we put it across to the patients. But in my experience, I don't put it as 60 to 100, I put it as 30 to 60. 60 to 100 is probably a old phenomenon.
Yeah.
Even if the patient loses about 5 or 10 hairs, they do come with a very anxiety. Then probably you'll have to sit with them, take your trichoscope, look at the pattern. Of course, when a patient comes with a complaint, it's your primary duty to look into it. Just because he has got a full of hair on the scalp, you cannot brush it across. Maybe he's harboring some of the miniature hairs in the frontal area. Go with the trichoscope, put it across, take the images of the trichoscope. What we do in the clinic, we have a chart, photographs where we have miniaturized hair, we have terminal hair, side by side. And we tell this is a diseased hair, this is a normal hair. Then we take a trichoscope and we show them what is disease, what is normal. Once they know that their hair is normal and probably the falling is their anxiety, that solves the problem.
Absolutely.
Next, you call them once in every 3 to 4 months. Probably they will have a family history of baldness. Call them once in about 3 to 4 months. Then you keep progressing, keep watching them. That's how you go forward.
Right. So, when do you actually start pharmacological therapy? At what age?
I think if you look at my practice, I have a lot of premature androgenic alopecia patients. I have started topical minoxidil by the age of 9 to 10 years.
Yeah.
That is the earliest age where I start. But after we have a lot of peptides into the market, which have got a DHT inhibition, scientifically proven, there are papers on that. Now I go slowly, I don't go aggressively. Very early stage of hair loss, obviously finasteride, dutasteride is not our cup of tea at that age. Still they are evolving as adults. So go with a topical minoxidil if you see obvious miniaturization. And otherwise you go with the peptides to maintain for about 6 to 12 months or 2 years. When you pick up that androgenic alopecia setting in, go with the peptides.
Right.
Advise them lifestyle modification. There's nothing called a age because minoxidil for congenital alopecia are given at the age of 3
Whatever it
months.
is, yeah.
There's nothing called that. But obviously, as you said, I think pharmacological therapy should never be brushed off. But I see a lot of patients come that, doctor, I went there, he said it's a normal for you, why do you worry about it? Nothing is there for you. You're unnecessarily getting anxious about it. They brush it off. But you cannot do that, you should not do that. No.
Right, right.
Patient is a patient.
So, is there any ceiling for minoxidil or finasteride?
Ceiling means I didn't get
How
it.
long you can rely upon that?
My answer is that as long as you want hair on the scalp,
Yeah.
it is something like you're suffering, your dad or your mummy is suffering from diabetes or hypertension. Where are you going to stop the medication? You're not going to stop the medication, you're going to go with that. And luckily, I think everyone should understand the medicines what we give for hair loss. They are not like diabetic medications, hypertension causing kidney failure, liver failure, that failure. No. They are most of the topical. They are very friendly. Even if you use for a lifetime, there's no problem. Right. And you hope for better things in trichology because every year, every month you have got something new in trichology.
Yeah. So, now this is my question. You have androgens plunge or surge at maybe at around 17 to 25. Then why do you lose hairs in your 40s and 50s? The maximum thinning happens in your 50s and late 40s.
That's an interesting question from you, because if you take real the hair follicle microenvironment, without obvious hormonal issues, there is a lot of other factors which play to the microenvironment that most of us forget. Most of us do not give our attention to that. The hair loss process would have started about a decade back in you. It was slowly progressive, you are not aware of it. Probably when you come at the age of 35, 40, obviously you will start noticing it.
Yeah.
So there is a trigger. There is already a loaded gun. It is waiting for a trigger through environment or stress or something. It triggers off, and obviously the stress levels between the age of 30 to 50.
Right.
Correct? You are just married, you want to construct a house, you want to stand in your profession. Already there are children, they are schooling, your parents are becoming old. What amount of stress, Atul, in that age group? I think 30 to 50 is
the maximum.
Very vulnerable age for stress.
Yeah.
So that's how it happens.
Yeah. We move to our next segment, which is telogen effluvium or stress hair loss. Okay. Especially in women, if you are a patient, how you should think that this is hormone mediated or this is stress mediated? For a common man, I want this answer.
Hormone mediated hair loss will always be very slow. In especially female, obvious baldness on the scalp would be seen after the onset of 2 or 3 years. Whereas telogen loss is not like that. Take an example, you have got a flu for about 7 days. After 4 weeks, you will see hair and hair and hair. It's acute telogen effluvium.
Exactly.
And you have stress, some of a kith or kin is dead in the family, or you have a very bad financial loss which brought to you on the roads.
Yeah.
See, 4 to 5 weeks,
Everything.
the hair is shed.
So whenever your maid is telling you or husband is telling you, most likely it is telogen effluvium.
And you see the hair on the pillow, hair in the bathroom, hair on the plate. I was wondering, today I was traveling with flight. One of the hair hostess, I was in the first row of the seat. She was adjusting all these luggages. I literally saw hairs falling. Because I was sitting there and I saw the hair follicles falling on the seat. So I thought that probably this lady should have some bad stress.
Yeah, really.
That's why she's shedding hair. You cannot shed hair like that, correct?
Right. So, for almost a year, 99% dermatologists of India practiced only trichology. That was the post-COVID phase. What do you think? What has changed post-COVID? Suddenly, why so much of hair?
There's a lot of this is interesting. See, if you introspect or if you go back or you walk back to the story of COVID, Number one, infection itself. Number two, the stress of infection. A very, very bad stress. You're losing someone in your family, you're going to ICU, they're coming back in ICU, your mother comes back, your father goes off. And you don't know when are you going to catch it up. That's stress. Number three, the vaccination. The vaccination is prepared in a very urgency. We don't know what is the implication of vaccine. Those vaccines are still haunting people. There are multiple factors with that respect to post-COVID loss. Even today, patients come and tell they have a hair loss post-COVID. Probably it's an extended manifestation of vaccination. It was hurriedly prepared. I don't say it is wrong. It is a bad. It must have protected millions of people. That's true. But obviously, anything which comes will have its effect. That would always come over a period of time, and that's what has happened.
That is even true with vaccines which have come over a period, developed over a period of decade also, they still have some side effects. So yeah, this is what.
That is how you look at the COVID phase.
Tell me your lab markers. What would you do if a patient of severe hair loss comes to you, male or female? Tell me your lab work.
First, I'll sit next to them. I don't sit in my chair like this. I'll go to the chair next to them. I put my hand on their shoulder. Tell what is your suffering. I know you have a hair loss. I acknowledge that. Because many a time people don't acknowledge.
Yeah.
You first acknowledge that your patient has got a hair loss. Slightly caress the scalp. Just see you got some hairs. Take your trichoscope, look at. The patient feels doctor is really concerned and really doing something. That 50% of it reduces hair loss, Yeah. When you show a concern that I am for you, I am with you in your face. We know that obviously over a period of 4 to 6 months, if you can, how are you going to hold your patient with you for 4 to 6 months? It's all your communication skills, Atul. You are also in the practice from so many decades. How beautifully you speak to the patient. What is your tone? What is your body language? How are you looking the patient at you with your eyes? All this matters a lot. So if you do that, their confidence is won. Obviously, we know that it is going to take a time. I tell my patient, see, you are shedding your hair today. The process has started 3 months back. Okay. And you have got 1 lakh follicles on the scalp. Even if you feel that 20-30% follicles are affected, it's around 20,000 hairs. If you lose it 100 hairs per day, take it as a 1,000 hair for 10 days and 1,000 hair per month. Watch for another 4 to 5 months, your hair loss will come down. Yeah, whatever which has come out of the bag cannot sit back. Yeah. You need to create a new hair. That is going to happen with the medicines what I am going to give you and what you are going to eat. Then why are you worried? In case if your hair is not growing back in another 4 to 6 months, we will be accountable. We will see what is the seriousness in the problem. So you show obviously the photographs of the patients who have come to you with pre and post. That's what we do. We have on the computer with patient permission we have taken. We show them this is how like this about 3 months back. This is how the 4 months after. And obviously your hair loss will stop around 6 to 8 weeks or 8 to 12 weeks, and you will get a good hair in a matter of 4 to 6 months. So counseling. Hand holding. Confidence pushing. That's it. That's the practice of trichology and dermatology.
Right. Right. Just a quick take. What is your take on biotin?
Biotin is a double-edged weapon. See, we know that hypervitaminosis of biotin causes hair loss. One side, see, the whole hype on biotin came from one particular sentence in textbook of dermatology by Rooks. When they were talking about congenital hair losses, biotinidase deficiency, they ruled that the biotin supplement gives a very good growth of the hair. That is taken by the pharma industries.
And put it everywhere.
Without background, without looking forward, it becomes a hype. But having said that, when you took into the hair follicle, which is a very, very dynamic structure, it itself has got hormones, growth factors, everything. For those enzyme activities, you require a biotin. I have gone through deeply into it. So maybe a 30 mcg of biotin per day is sufficient enough to do that job. So don't put biotin 5 mg, 10 mg. No, you should not do it.
So now we come to the most exciting part of trichology.
You're always exciting, not only this.
So what has changed over a period of, I think, 3-4 years is regenerative approach.
Correct.
It has come since a decade. Earlier the PRP came, and then crushing the tissue with SVF and came. And now exosomes and biorejuvenation, SVFs have come big time. So you have been a very strong proponent of regenerative
Correct.
dermatology.
Yes.
How do you define its role, this role of regenerative medicine in trichology?
It has a absolutely definitive role, there's no doubt about it. The whole concept of human regeneration of tissues is changing. Actually, maybe in a couple of decades, you may think only about this. You may not think about drugs at all.
At all, yeah.
That is a level of experimentation, that is a level of evidence, that is a level of encouragement to the regenerative medicine. We know that the hair follicle, again I will come to that hair follicle, which is very dynamic, which is metabolically very active. It has got the richest blood supply, nerve supply, hormone factory, everything. So think about the hair follicle as an organ. What is required for organ? There will be communication from cell to cell. For example, extracellular matrix has to communicate with the bulge. Bulge has to communicate with the papilla, which is the air producing factory. So when everything is happening, it is once, because there is a genetic influence, environmental factors, infections, inflammation, microinflammation, it is coming and hitting that. You need something to rejuvenate, regenerate, apart from the minoxidil or a finasteride, where it was lacking. Now that niche is getting filled up.
And missing link is
Missing link. That missing link is regenerative medicine. They reduce microinflammation, they reduce DHT at the hair root, they encourage talk between the cells, they produce cytokines, they improve signaling, they improve blood supply. What they do not do? Small molecules, they just get in there, either in exosome or a growth factors. They do all the job what the hair follicle is supposed to do, but the hair follicle is not able to do. It is tired. The mitochondria of the hair follicle is not in a position to look at what I want. It's confused.
right.
Whether I have to produce cytokine or whether produce growth factors, it is confused. So you are letting in all these small molecules into the environment, microenvironment of the hair follicle, thereby pushing all the signals which are required for morphogenesis of the hair follicle. That's a beautiful story. I think we can talk hours together about regenerative medicine, but this is how exactly the change is going to happen.
Just for common man's understanding, how exosomes differ from PRPs and PRFs?
See, if you take the entire history of a hair follicle treatment, everything is anecdotal. Minoxidil is not for hair follicle first. Finasteride is not for hair follicle first. Tofacitinib is not for hair follicle first. Similarly, when you think about this, exosomes, there are tiny vesicles containing lot of factors, especially miRNA. It has got, I think it has got some secretome, then it has got lipids, it has got amino acids. There are a lot of things. They are actually secretion of a cell. When cell is getting divided, getting rejuvenated, getting duplicated, it secretes a lot of growth factors, enzymes which are required. So one of that is exosome. So exosome comes, and the problem with the exosome is that we don't have any guidelines for preparation, we don't have standardization for preparation, we don't know how it is going to penetrate into the skin, no idea. The quality studies have not been done. But having said that, same thing was there for PRP before.
Yep.
Now the science is science. Anything which comes, I think we should always be looking forward to use it, get your own experience, get the standardization done. Everything you should. Once you start telling that what is happening with these exosomes to my patients, to the company or a manufacturer, he will modify it. That's what happened with PRP.
Right.
So exosomes, topical preparations, I have a doubt of penetration. Standardized preparation, I have a doubt, because Normal exosomes, now it is a plant derived exosomes or salmon testis derived exosomes. So we have used it, but we are not able to get what is hyped up about exosomes so far. So we need to look for, maybe once we are thorough with injectable exosomes, where it can get into the 1.2 millimeter of the follicle, I think that is where the game changing is going to happen. These exosomes have to come from either human hair follicles or from fibroblasts or from adipose tissues. When you take them out, culture them, put it,
Yeah.
it's a game changer.
Yeah. So as you have said, the topical exosome may not be all that effective.
Correct.
At the very best, it will be an adjuvant. So you would need either maybe injection or maybe microneedling or some other device to be delivered at particular
like laser assisted drug
laser
delivery.
assisted, yeah.
That's what.
Coming to SVF, stromal vascular factor, can you explain what does it do?
Yeah,
to
that's
hair
the one.
and how
That,
does it
that is one of the fantastic revolution in hair science now, because QT started doing the autologous the SVF, whatever you say. The results are phenomenal. So basically, we are looking at regenerative medicine, stem cells, signals, cytokines, getting into the follicle and educating the follicle. This is human adipose derived stem cells.
Self.
It has got,
Yeah.
SVF is stromal vascular fraction, which contains all the growth factors, all the pericytes. So many things in that. It's a rich cocktail, in fact, for any regeneration of any tissue, for that matter. So with these growth factors, with these, cytokine production, with pericytes, adipocytes, stromal factors, it repopulates hair follicle very nicely. One thing we need to remember, you cannot grow a new hair follicle at all. I am watching for it. I am hoping for it. But you can always convert a miniaturized hair follicle into a terminal follicle. Whatever may be the medicine as on now on the earth is doing the job of converting a miniaturized hair follicle to a terminal hair follicle. The follicle which is sitting like a Buddha is became like a very active personality. So that's what everything does. The SPF does the same thing in an authenticated way, scientific manner.
Right.
The evidence is growing, and we have seen results on our own. So we do it maybe once in 6 months to 1 year. The frequency is also less when compared to PRP. So that's how the SPF works.
Where do you think future of hair regeneration is going? Lab derived, culture derived hairs? Are we close to it or still a far-fetched dream?
The problem is hair follicle is an organ. To grow a cell is easy. To grow a tissue is also easy. But to grow an organ which has got so many aspects itself is very tough. So the experiments like Lepricel have failed already. But the cloning is on the process. We have not got a breakthrough in cloning. But over a period of time, I think there are two areas where the things can go well in hair science. Number one, as you said, the follicle growth in the lab. Human hair follicle growth from the same patient in the lab and transplant it to the thing. Second one, the AI directed precision medicine.
Yeah.
Atul, frankly, I'll tell you, we have not understood even 3 to 5% of the hair follicle morphogenesis so far. I've gone deep into the follicle. Only 3 to 5% we know about it. Imagine with AI coming into the role, understanding the follicle to its full potential, what could be the game change in hair morphogenesis?
True.
That we are going to see in our lifetime.
Yeah.
It will happen.
It will happen. Yeah.
It will happen.
So what this transformation, according to me, which is gone in past 1 decade, from miniaturized follicle, we can get into terminal follicles either by our own growth factors or plant growth factors or any other growth factors. problem comes when you don't have enough donors and you still want that hair
Correct.
regrowth. That's where I wish that someday that
We want that organogenesis.
Organogenesis.
You rightly said it, because if you are thinking of grade 6, grade 7 alopecia,
Yeah.
where you don't have miniaturized follicle at all,
Yeah.
so everything is dead. Where will you regenerate apart from the hair transplant? The hair transplant has its own pros and cons. You should have a good donor area, you should have a good surgeon to do it. So all these are factors. So I think probably that's where you will.
And there is a life to hair transplant, the transplanted hair.
Hair also, true.
That is also,
Correct.
the disease is still on. So you have to take care of that. So now we come to a few myths and maintenance mindset. What is the most one myth you want to ward off today, that this should go out of this about hair loss or hair, whatever, this androgenic alopecia?
I think I would rather put 3 things here.
Yeah.
Number 1, hair transplantation is not the permanent cure for baldness.
Fabulous.
First myth. Second, all hair loss are not same. People feel hair loss is same. That's the second myth. Third myth, it is possible to regrow the hair. Believe in medicine. Believe in dermatologist who is a true trichologist, who knows about hair science. The myth that the alternative medicine gives you relief for hair loss disorders should go off. Strongest myth.
Okay. How do you define success in hair loss treatment? It should be cosmetic or clinical or emotional. What is your idea of success when you?
Number 1, of course, you're thinking about, tell me, cosmetic means it's coverage.
Yeah.
You need to see the coverage after starting the treatment. Patient should feel happy. The second one you said is
clinical.
So
that is what you see.
What we see, the caliber.
Yeah.
What we see is caliber.
Yeah.
We don't see new hair follicle.
New hair follicle.
We see caliber.
Yeah.
Second one.
Yeah.
The third one?
Emotional.
That's very, very important. That is, I think ultimately it will all boil down to the holding capacity of yours with the patient. How beautifully you make them happy and bring them happy to your clinic again and again.
Yeah. I would put it another
And emotionally, maybe psychological stresses has to come down.
Yeah, that is what
That's
I
it.
was.
Psychological stress has to come down.
Yeah.
Education is a vaccine there. So that's it. Coverage, caliber, and probably confidence. C.
Yeah.
Third C could be confidence.
Confidence. Yeah.
Infuse confidence in your patients, and be confident yourself to treat.
So, what is the kind of lifestyle modification you advise?
I think that's a very, very important question with respect to hair disorders. Not only hair disorders, many of the dermatological conditions which have got the aesthetic value, I think they should follow strict, not a strict, at least moderately good lifestyle, having good diet, having lot of fruits, vegetables, barring bananas, then barring potato, where it's calorie driven. Then probably they should have a good protein and regular exercise. Most important is rest and sleep. I think now the youngsters, they come, what time you go to bed yesterday? 2 o'clock.
2 o'clock.
What time you get up? I got up at 7 o'clock sometime because you have to go to office. If you don't go to office, college girls, they get up at 12 o'clock, 12:30. Mothers complain, early, please tell this my daughter that she has to sleep early, get up. Totally it is disarray, always with the mobiles and chatting. They don't know, once they are getting to the glue of mobile, they will be chatting till 2:30, 3 o'clock. Tell me, God has made a circadian rhythm for you. He has created a human body or a life, not only human, life or a life cell, whether it's a plant, animal or human. He has put that you have to go to bed at this because your body requires rest. The whole regenerative process of your body cells take when you are taking rest. That youngsters don't understand. At rest only they get all the required factors, growth factors or the calorie, everything comes at rest. They have to recuperate, regenerate, because from morning till evening it is exposed to so many emotions, environment, stress. Allow your body to cool down. You don't allow it to cool down.
And God has given us a elixir of youth, which is called as melatonin, most powerful antioxidant on
Antioxidant
earth,
on the
and your own hormone, and you are destroying that.
Correct.
By
It is waiting to get secreted at 2 a.m.
Yeah.
Tell me. It is obediently waiting to get secreted at 2 a.m. You don't allow it to get secreted.
So,
we have coffee here. So if you want to take a break, we'll finish.
we'll just have 5 more questions.
Yeah.
So now we come to this round, which is rapid fire round.
Okay.
What is your favorite molecule for AGA? One molecule.
Finasteride.
Finasteride. Yeah. Do you think topical finasteride would work in
Yes,
high
it would
concentration?
work.
Yeah, this is
It would
my
work.
go-to stuff like nowadays. What are you most excited about? Any breakthrough technologies?
In hair,
Yep.
I think I'm excited about laser for hair growth, like recent red touch which I did on myself. I could able to get a very good growth of the hair without any supplements. So that's most exciting, the laser biomodulation of hair follicle. Yeah.
Any article, any book, any podcast which has changed your thought process about how to approach hair?
I think this is the one which I am doing now. Maybe I'm going to get some more insights from the discussion what I had with you. So when you start discussing with friends, with like-minded colleagues, the ideas will float. They get transferred to, actuals.
One question I have. This is out of a book called as Breath. So I'm forgetting the name of the author, but he has discussed about various method of breathing. He discussed pranayama, in which he discussed all 5 types of pranayama. Then he discussed about Buddha's way of controlling breathing. This is how the Buddhist monk high up in Tibet, they control their body temperature and everything through that. And there is Wim Hof method of breathing, in which you train yourself through extremes of temperature and still remain calm. And one finding was there that with breath you could regrow hairs. So,
possible.
do you think oxygenation, do you think stabilizing of hormone, do you think stabilizing the circadian rhythm, do you think correcting the nutritional anomaly by healing down everything and making your gut absorb those micro minerals which because of inflammation it is not being able to absorb? These can be the future of the holistic healing or the integrative healing as far as your hairs are
Certainly.
concerned.
Certainly.
Because I am a firm believer of that.
Certainly.
In the end, it is one body. So you have to look holistically as one human life.
Correct.
And which is, it's all about reducing the inflammation at microcellular level.
I agree with you. Ultimately, it is a mitochondria which directs you.
Yeah.
Correct, in the cell. And breathing exercises work on mitochondria very well.
Very well.
On all mitochondria.
Yeah.
So it's true.
So, as we come to the conclusion of this, one message for young dermatologists or aspiring dermatologists or the patients. Where are we heading as far as the crowning glory is concerned?
Correct. I think patients should understand that dermatologists are true trichologists. They should not go by advertisements, by peer pressure. Identify your dermatologist nearby you. They are the better people who have understood hair science. Number 2, be compliant. Because the hair loss of US has started about 3 or 4 months back. It is going to run for another 6 months. So totally it's about 6 to 8 months. Give that time to yourself, to your brain, to your mind, and to the doctor whom treating you. And whenever there's a prescription of medicines, please follow the instructions properly. Remember, your hair follicle medicine has to reach around 40 to 50,000 follicle. If you apply 0.5 ml, nothing is going to work. Your doctor will tell you to apply 2 ml, but you apply 5 ml, it's not going to work. B, do justification to the treatment what is given. Respect the medicine, respect the doctor. That is for patients. For young dermatologists, please do not brush off hair loss as simple problem. Have trichoscopy with you. Please follow trichoscopic rules for hair loss. Every hair loss can be detected with that. Number 3, trichoscopy should be used in every patient of hair loss. Number 4, counsel them well. Try to hold them back in your fold so that they are going to win their confidence and come away from psychological stress of hair loss. And be open to technologies. Be open to new medications. Don't reserve yourself. That is the message I would like to give to the young dermatologists, because it's going to be a huge practice, arena for you. Apart from, see, if you look at dermatology practice, pigmentation, acne, and hair, 70% of your practice is over.
True.
So when you have so much of that, why can't you learn about it? Why can't you think about it? Why can't you implement what you have learned?
Absolutely.
So have a passion towards psychology. There are great teachers like Atul who can teach if you don't know. So catch hold of them and train yourself, educate yourself to bring a good quality of life to your patients. Ultimately, as a medical doctor, my aim should be to bring good quality of life to my patient. So we'll all work towards it. Everything else will follow. Right?
Thank you, Dr.
Thank you, Atul. Thank you so much
Thank you.
for this insight. I think I must be thinking something beyond what I have thought so far about hair follicle.
So hair loss is just not about losing few strands or lots of it. It's about losing your confidence. It's about losing your self-esteem. And as Dr. B.S. Chandrashekhar has put it, times have changed. Things have changed. There are treatments which is beyond these 2 drugs, and future holds much more. Things are changing almost every year, so there's no need to worry, and do worry about your hairs, but not about losing them. How you can make them more healthier. Thank you. Bye.